Everyone, we are going to get started. It is noon. I just want to thank everyone for getting on and participating in our webinar. My name is Renee. I will be the host today. This is my first time, so please bear with me. But I am with the Metro Council. If you guys are not familiar with Metro Council, we're the Metropolitan Council of Community Mental Health Centers. We are a collaborative membership organization representing the public of the greater Kansas City area, where we provide support to our members, organization, and education information and resources to the public in accessing quality health services. We also host our mental health KC conference every May. And we have these webinars. They are the second and fourth Thursday of every month. And at the end of the webinar, we are going to put a link in with a password to get your certificate of attendance for this webinar. And also, before I introduce our speaker, I just want to let you know that we do have a disclaimer, Metro Council. We want to say that the views and opinions of the representative are those of the speaker and not necessarily representative of the opinions of Metro Council. So I am now going to introduce you to our speaker. His name is Mark Miller, and he will be speaking on diversity, equity, and inclusion, a perspective on behavioral health. Mark is the Executive Vice President of Behavioral Health at Swope Health Services, a federally qualified health center located in Kansas City. With over 250 employees, Swope Behavioral Health Departments provide residential, psychiatric, therapy, case management, substance use disorder, homeless, crisis intervention, and transportation services. Located in the urban core of Kansas City, this department sees approximately 6,000 unique clients and delivers over 90,000 services in 2021. Swope has a long tradition of being an anchor in the provision of behavioral health and substance use disorder services in the Kansas City area and is proud to provide integrated behavioral, dental, and physical health care in the community. As a volunteer leader, Mark has served on numerous national, statewide, and local board committees and task force. He currently serves as board president of the Resource Development Institute, additionally serving on the Health Forward Learning and Action Network addressing diversity, equity, and inclusion. He received the State of Missouri Pioneer Award in 2016. He was elected president of the University of Missouri Alumni Association in 1998. Also, he has been awarded the University of Missouri's Diversity Award in 1998 and 2002. And in 1995, Mark was awarded the University of Missouri's Distinguished Alumni Award. Mark has a passion for public radio, and for 25 years, he was an on-air programmer for KOPN, a community radio station in Columbia, Missouri. Welcome, Mark.
And thank you, Renee. Can you hear me okay?
Yes, I can.
All right. And wanting to make sure that our slide is up on the screen.
Yes, it is.
All right. Well, thank you for those kind remarks, Renee. And I look forward to our presentation today and want to thank the Metro Council for the opportunity to present here at the end of Minority Mental Health Month. So we're going to start our presentation today just with kind of a little brief introduction of the title and the diversity, equity, and inclusion, a perspective. And so I didn't want to say that this is a universal perspective at all on how diversity, equity, and inclusion is. I think it represents at least a portion of my perspective on how to look at the behavioral health system. We're going to cover many, many years in this presentation of the behavioral health system. And as you notice, from time to time, you'll see it jump from one time period to another time period. So that's purposeful. So if you see us cross decades in a single bound, then that is very purposeful. So we will go ahead and get started. And I will. Okay. Just to let you know, I want to thank Jennifer Monroe for being here to help me with a little technical assistance and making sure that things work out well. Bob Marley, in one of his songs, the song being Redemption Song, says, "Emancipate yourself from mental slavery. None but ourselves can free our mind." At the end of the presentation, I'm hoping that you can reflect back on the things that were presented and understand the context of what this means, because not only do we have to think consciously about what it is we do, we want to make sure that we are not locking ourselves into ways of thinking that then end up with results that are counter to what we are trying to achieve. And so part of that emancipating yourself from mental slavery is encapsulated in that, making sure that you are constantly looking at your own thoughts and your own actions to make sure that you are not enslaving your mind with thoughts that may be counterproductive to the things that you want to do. So we're going to go back to the 1600s very briefly and think about when Africans were being brought here as enslaved persons, and those of us who are their descendants now. And the fact that a group of people who were once considered property and not human beings, and the effects that this have on the descendants of those persons should not ever be underestimated. Many of these things will carry on not only to the persons who are alive today, but to the descendants of those of us who are alive today for many, many, many more generations. And so the effects of what happened not only happened to the generations that were immediately affected, but for those generations yet to come. Concurrently with the slave trade, I also want you to conceptualize the colonization of the Americas and the displacement and subjugation of indigenous people. And so not only are people being brought here as slaves, but the indigenous people who are here and who were here for thousands of years prior to colonialization are now being subjugated and they are being displaced. So if you think of things like the Trail of Tears, or if you think of some of the reservations that are here in the United States, they are not there by happenstance. They are there by purpose, and there for those effects that have that long lingering aspect to them are felt by the folks who are the descendants of people who went through that at the time. I also want you to think about the various religious institutions and how those institutions replaced long-held beliefs, systems of the folks who were brought here, the folks who were already here, even the changing of some people who did not come by either of those means. What does it do to one's psyche to be considered less than human? As we think about a lot of the work that was done in the early parts of the history of this country, which were primarily agricultural in nature, and that the workforce was needed to drive an agrarian economy, then all of a sudden it started to give way to the Industrial Revolution and the emerging needs that came with the Industrial Revolution. And so then you have people who are coming here from the Asian continent as immigrants who's basically were in a servitude sort of position that was supported by all kinds of laws that were oppressive in their nature and by design. And so you have an agrarian society becoming an industrial society, but yet you still have this underpinning of laws and policies that are oppressive to the people who are actually fulfilling many of the roles that are necessary to support those economies. The change in the economy also then brought the rise of American cities. And now you have the growth of cities, and we're moving from being a rural country to a city-based country. And the new city dwellers not only had a new reality in how the community was structured, but now how the medical care was provided and by whom. So we move from the 1600s, and as I said, we're going to take some leaps and bounds into the 1800s. And the asylum concept, at least in this country, became popularized in that. This included poorhouses or hospitals for social ills, and these were for persons such as prostitutes. The orphanages were built, and it also began to mark the beginnings of the proliferation of using our jails and our prisons as places to house people who were mentally ill and also marginalized people from minority communities. In the United States, the erection of the first state asylum was in New York, and legislation was passed to fund it in 1842. The Utica State Hospital was opened approximately in 1850. During that time period, and I think those of you who are historians of the mental health movement recognize the name of Dorothea Dix. And Dorothea Dix moved around the country in an effort to get states to create mental health facilities as versus putting people who were mentally ill in jails and in prisons. Here in Missouri, where the first mental health institution, which is Fulton State Hospital, west of the Mississippi River, was founded, Dorothea Dix was one of the primary drivers to meet with the state legislature at the time to get them to utilize state funds in order to open Fulton State Hospital. Similar movements were going on in the state of Kansas at the same time. So you have this movement across the country now of creating state hospitals. One of the treatment modalities at the time was called the moral model. And it emphasized the opportunity for patients who are now living in urban environments to escape the pollution, the rigors and stresses of city life, and seek the comfort and sanctuary available within a more pastoral asylum type setting. This is one where it was felt that people could look upon rolling hills of grassland, have fresh air and sunshine on their faces, and participate in meaningful and restorative work and be treated with dignity and respect by the staff who cared for them all and whom lived on the grounds in this familiar arrangement. If you were to have visited some of the state hospitals, most have now taken some of these older buildings down, but you would have seen homes for the superintendents that had lived there, as well as you would have seen places for the staff. And at one time, they were so self-contained, they had their own cemeteries. And if you go to certain places, you will still see the cemeteries for the patients who lived in these places. And so therefore, if you were committed, these became lifelong commitments to live in state hospitals. What you should be seeing now on your screen is actually the insane asylum in St. Louis, Missouri. A portion of this building still remains and sits on the St. Louis State Hospital grounds. I have personally spent time in the building with the dome on it. And for those of you who know a little bit more about St. Louis history and recent St. Louis history and mental health history, the Missouri Institute of Mental Health is actually inside this building on some of the lower floors of that building. And what it's called in South St. Louis is the Dome Building because of the dome. But at its origination, it was the insane asylum in St. Louis, Missouri. I'm going to move forward a little bit more. And a book that came out by a person named Alex Stern was about eugenics and the faults and frontiers of better breeding in the Americas. Can you, for a moment, conceptualize that here it is, you've got people in various states, and I don't mean states as in the United States in this sense, but I'm talking about states of their humanity. And in the early 20th century, you have medical hospital superintendents, legislators, and social reformers affiliating themselves with this eugenics movement. And what it theorized was that there were people whom, because of their heredity, that posed a threat to society, such as criminality, feeble-mindedness, and sexual deviance. And so the idea of sterilization is born, and it is being imposed upon people in society because of the belief that their genetic code some way caused them to be inferior. Those are the sorts of things that in the history of our medical practices, be they mental health or primary care practices, are the underpinnings of why we have to be constantly vigilant about understanding where we came from and keeping our eyes on where we're going in the medical community. And so these things, sometimes people say we make them up and they don't exist. This is a very clear indication of one of those points in times where it was thought that let's sterilize people and we can sterilize our way out of feeble-mindedness and criminality, as well as we are either going to put people in hospitals or we're going to put them in jails and prisons. So let's move forward a little bit more. And we're getting now into the 1960s. And in the 60s, there are a lot of things going on with federal and state legislation trying to end discrimination that is, as it was known at the time. And it was also a really rough time for people who had mental illness and those who were marginalized in the system. So one of the pieces of the movement that created the places where many of us work now started actually back in 1963. And it was the Community Mental Health Centers Construction Act. And it was passed in order to change the way and the location in which persons with mental illness were treated. The Community Mental Health Centers Act recognized that the hospitals often had just become places of custodial confinement rather than treatment. And funding was being provided to the states to help build community-based treatment services. At the same time, you have things like the Civil Rights Act that was passed in 1964. And under Title VI, that declared it was illegal for any facility or service receiving state fundings to discriminate on the grounds of race. So here is where we start to get a rub that still exists today, and we'll talk a little bit about that at the end of the presentation, where states said that they would not follow the policies that were being handed down, and that the policies of racial segregation were still those things that they wanted to follow, and that they did not mind losing existing funding and not even receiving any Medicare funding. As much as funding drives what it is we do in our world, it is something that we should also be mindful of, that states have chosen in many cases to not even accept federal funding in order to help provide better care because of this idea that states' rights supersede that of the federal government, and they would prefer not to have that funding. I think we can only take but a moment and think of current situations in our two states where we have been locked in battles related to the expansion of Medicaid, and how that continues to be a battle that is fought in both Kansas and Missouri. So rather than accepting ways to end segregation, some of the states continue to fight. They claimed it's their rights to run the states the way that they see fit, free of federal interference, and that it was medically necessary, especially during the early years of this desegregation in the 50s, 60s, and into the 70s along racial lines. So let's even bring it down a little bit closer to here at home. So we're going to talk a little bit now about the early history of inpatient mental health care here in Greater Kansas City. And the Greater Kansas City Mental Health Foundation opened the PRC, which is the Psychiatric Receiving Center, around 1954. And just as a disclaimer, which unless you are really into Kansas City mental health history, the Greater Kansas City Mental Health Foundation is now RDI. And I know Renee told you that I was the president of RDI. And so I don't think anybody would have caught that other than me telling you all that that Kansas City Mental Health Foundation has morphed itself into what RDI is today. But at that time, it had practicing psychiatrists and those in the medical field much different than what RDI is now. The PRC was the first racially integrated psychiatric facility in Kansas City. And its purpose was to provide mental health services to the indigent Kansas City, Missouri residents, or residents really in the area, and serving as the psychiatric section of the general hospital of the city. The PRC was one of the pioneers in the community mental health setting, using new psychotropic drugs as well as treatment therapies. Some of the agencies that we work for here in Kansas City actually have grown out of the treatment, and not during the general hospital days, but we'll talk a little bit about what it morphed into for the Department of Mental Health. But some of our agencies actually have grown out of the state running them, and now they're being run in the community. PRC was a recipient of the Gold Medal Award of the American Psychiatric Institution. Its 2 inpatient units, an admissions unit and discharge unit, emphasized the community-oriented treatment, and its outpatient program maintained patients while they continued to function in the community. And what we do now hasn't fundamentally changed that much from that time period. In 1963, the Kansas City General Hospital and Medical Center took over the administration of the PRC. And the PRC Foundation remained in an advisory role and moving into new areas of mental health research and programming. So what you can see, how the PRC, when it's taking over by the General Hospital, moving into the advisory role, went into mental health research and programming, and now you can easily, or hopefully easily make the connection to how RDI came into being. In 1963, also, the legislature upgraded the state psychiatric services by authorizing the Division of Mental Diseases, which is now known as the Missouri Department of Mental Health, to develop 3 intensive treatment centers across the state. So in addition to Western Missouri Mental Health Center in Kansas City, Malcolm Bliss in St. Louis, and Mid-Missouri Mental Health Center in Columbia, those 3 locations were set up to cover, respectively, the entire state. And so basically, you got Malcolm Bliss covering the eastern part of the state. Mid-Mo is what we called it when I worked in Jefferson City. Mid-Mo covering the center part of the state, and Kansas City covering the western part of the state. So General Hospital number 2, formerly for African-American patients, was purchased from the city and remodeled and enlarged. It was directly adjacent to the PRC, which is Western Missouri Mental Health Center, which opened on March 11, 1966. And the 2 facilities worked together to continue and expand the services to the indigent, and extended those services to all the residents of the 31 counties in Western Missouri. The total assimilation of the PRC into the Department of Mental Health was on March 1st, 1970. The picture that you see now, and the caption below the picture, is this building, which was General Hospital number 2. And it was for the care of Negroes, as you can see if you can read the caption, since 1908. This is what becomes General Hospital number 2, which eventually becomes the precursor to Western Missouri Mental Health Center. And so sometimes they say this picture is worth 1,000 words. So wanted you to see the picture of it. And I was absolutely sort of fascinated, being a little bit of a history buff, in order to be able to find this picture and see it, because I had never seen it either. So for those of you who are seeing this for the first time, that is what it looked like. Gonna move forward a few more years and going to talk about the first comprehensive report on race and mental health. So in December 1999, Dr. David Satcher, who was the first African-American U.S. Surgeon General, issued a comprehensive finding on race, culture, and ethnicity. One of the things it talked about was how mental disorders affect nearly 1 in 5 Americans in any given year, and that it is the second leading cause of disability and premature death in the United States. And for those of us in the field, we clearly understand that our clients are dying 25 years earlier than many of the clients that we would see, just especially for those of us who have primary care and behavioral health care, than we would see the people who are being served in our primary care clinics. It also went on to talk about that we needed to do more research in understanding the brain and generating effective treatments for those conditions. And it cited that still more than half of those who need treatment don't get it. And does that ring a bell with today? Aren't we still dealing with so many people not getting treatment? The supplement also said that in its key findings, there was a existence of striking disparities for minorities in mental health services and the underlying knowledge base around minorities and their mental health needs and concerns. And that racial and ethnic minorities have less access to mental health services than do whites. These are the very same things, I think, if you go to most of the diversity, equity, and inclusion sort of seminars, or if you're doing readings or research, you're still finding that to be equally as true today as it was when this supplement was put into place by Dr. Satcher and the team of the many folks who helped write it back in 1999. And we are now almost 25 years removed from that. But the fundamental underlying facts, I think, are still the same. So what things are we facing 25 years from when that came out? We are still facing the continued criminalization of the mentally ill. And that we all know that persons are more likely to be a victim than a perpetrator. We still see disparity in funding in public and the private mental health payers. I think it was recent as earlier this week, there have been a couple of stories about how that is still trying to be addressed through legislation, and that there is parity in the amount of payment for mental health services as there is for primary care services. Almost in every state, there are gun laws that are being debated and red flag laws and background checks, and mental health is just weaved through all of those discussions related to the red flag laws and background checks. Now that we have had social media as part of our lives, we're now starting to see more and more research about the effects of social media on the mental health of children. And I did read a report recently that suggested that young women were being affected more than young men. I don't think that the research is as solid yet on that, but you're starting to see emerging themes of people who are researching and some of their initial findings. We in both of our states are having raging debates on gender affirming care. That is affecting every one of us in the services that we provide and how those services are being provided. I think here in Missouri about the emergency rule on gender transition interventions and the Missouri Attorney General's office and the fights that are going on in the courts related to this sort of emergency rule being put in place. We also see more and more discussions about the aging of America, especially with the baby boomers, of which I'm one, and our mental health care, and dealing with dementia and Alzheimer's and other things that go along with aging. We continue to see the need for looking at all of the policy issues around alcohol and drug addictions. We now have, as part of our daily lexicon, opioids and fentanyl. One of the things that's happening in Missouri is that the highest rise in the deaths related to fentanyl, and this is particularly true on the eastern side of the state, is among African-American males. And so I know that the agencies on that side of the state have created some specific interventions with Missouri Department of Mental Health funding and funding coming from the opioid settlement to try and address this issue. We have the emergence of emergency services and the evolution of the 988 mental health crisis response system. And actually this month is the 1-year anniversary of the states kicking off 988. And as we look at how are we doing and now moving from trying to use a various number of local and state and regional telephone numbers and move those into a 988 setting to be able to provide those crisis services. And finally, I want to go back to the thing that I said about Bob Marley and emancipating yourself from mental slavery. We need to be able to think clearly and freely about what it is that are the challenges of our time and how do we meet the challenges of our time and not lose that hindsight of the challenges that have gone on before us. Because we could easily find ourselves buying into something that may not be the best thing for us in order to meet the challenges of our time. We're looking at the Dobbs decision, which has to do with Roe versus Wade and reproductive rights, and saying that it's the right for the states to determine which way to go. We just spoke about gender affirming care in Missouri and Kansas. We daily are confronted with violence in the communities across the country, and almost everyone now says it's a healthcare issue. Many people call it a mental health care issue. What is the role that we as these organizations and we as individuals are going to play in trying to help that? And finally, how do we avoid having mental health be a pretext for so many things that have to do with healthcare and non-healthcare debates and lawsuits that are going on in our communities that we serve? Thank you for listening to a perspective, and that's why I started it out that way, to say this is a perspective. Obviously, we went from the 1600s to today. That's covering over 400 years in about 30 minutes. And the idea was not to delve deeply into any one of those time periods, but just to give snapshots along the way of some things that I think as we as practitioners in the mental health field should always be mindful of, and that we do take a look back sometimes as we look forward to the challenges that we face. And so Renee, at that point, I will conclude the presentation and turn it back over to you.
Thank you, Mark. That was a wonderful presentation. Lots of history. I love it. Now is the time for any questions from Mark. This is a safe, free zone. So does anybody have any questions? You can put them in the chat or in the Q&A. I did put a link into the chat where you can go and get your certificate of attendance. So you can do that. Also, we have our next webinar, which will be the 10th of August, and it will be with Dr. Keller, and the topic will be school avoidance. Oh, it is saying that they're not seeing the link in here. Well, I just put it in. Let me see if I can resend it. Oops. Okay, I resent it. Can anybody see it in the chat? Okay, let me put the password in there as well.
Renee, we do have a question.
Okay. One of the questions is, what are the best ways to advocate for funding on the state level?
So I think one of the best ways for funding, especially if you are with one of our community mental health centers, is to work with the leadership in your organization and make them aware of what it is that you are thinking about and what it is that they might be able to advocate for on your behalf. They can take that advocacy then to the Missouri Behavioral Health Council, and we meet once a month at the Missouri Behavioral Health Council. And that's a good forum to bring forward new ideas, things that we think need to be addressed. And if you're seeing it, it's probably not just unique to your agency or something that you're seeing, but maybe more universally applied. And therefore, sort of building that groundswell of the things that you need to bring it to the Department of Mental Health attention and say, hey, we believe there needs to be some funding for this. And so I think that is probably one of the best avenues from you through the leadership at your agency and from your agency to the Missouri Behavioral Health Council and then to the Missouri Department of Mental Health. And eventually, probably if it needs legislative authority, then they are the folks who would bring it forward for legislative authority.
Thank you. Is there anyone else? Have you seen any recent D&I initiatives in mental health that has been really impactful?
So yes, and I think that there has been a lot of work in making sure that issues around LGBTQIA+ are not lost. And I think that has been very impactful, especially in the mental health arena, and now even expanding itself to a broader arena. And so the folks who have been in our space in the mental health world, I think have been the champions in this state, along with others, but have been some of the leading voices in trying to move that forward. So, and the recent, I would say, last 2 to 3 years, I think that is something that we can definitely point out that's in this space that has taken hold and has begun to move throughout the organizations and into the legislative process.
Thank you. Anyone else? These are some great questions.
Yes, they are very good questions.
Well, I don't see any more, so we will go ahead and close out. Thank you again, Mark. That was so very informative. The older I get, the more history buff I become too. So I loved the history lesson. So once again, look for in a couple of weeks our next webinar, and I will see you all later. Thank you.
And thank you for having me.